I am here this morning to testify in support of H 1267 and S 766, an act establishing Medicare for all in Massachusetts that I filed along with Chair Garlick and Senator Eldridge. This is my second session testifying in support of this bill as a member of the legislature. And I must admit that in some ways it's a struggle to testify because I know that, as you've mentioned, there are many people who are signed up to testify after me, and they will speak, I believe, to the importance of this bill and the failings of our current healthcare system. I expect to hear many poignant stories today, and I look forward to that testimony, even though I think it is often hard to hear. So while my family has been personally affected by the ways insurance companies limit who can get care, what care is available, and where it can be obtained, I'm instead going to focus my remarks this morning not on the why of the bill, but on the how. While this bill has been filed for a long time, I want to underscore the work of my co-filers. I see Chair Garlick is already here, and Senator Eldridge, and all of the advocates who have really worked this session to try and change and improve the bill. We've spent time looking at the ever-changing healthcare landscape and attempted to adjust the bill. And the goal really is just 5 things. That makes it seem small, and we know that this isn't, but I think it's important to underscore what the bill truly does. So it declares healthcare as a right. It eliminates copays, deductibles, and coinsurance. It creates a healthcare trust. It levies a 10% payroll tax to fund the trust, and it sets forth what covered care would be. That healthcare trust created in the bill, which I have to admit I sometimes think of as a health policy commission with real teeth, would be responsible for paying for all medically appropriate healthcare services performed by eligible providers or facilities chosen by the resident. And it would also fund capital improvements to make sure every part of the state has adequate healthcare facilities and resources, something that is very near and dear to my heart. Any Massachusetts resident would be covered, as well as any non-residents who work more than 20 hours a week in the state and pay state taxes, as well as non-residents requiring emergency treatment. We tried to look at what Mass Health was doing and what other states are doing as we formed this part of the legislation. And there's a common misconception that this is a system that would revolutionize healthcare. What this bill does is it changes the payer. So in this bill, we are not telling people who has to provide their healthcare. And in fact, we explicitly state that any providers licensed to operate in Massachusetts could provide care and would be paid for by the trust rather than a health insurance company, as is our current model. And there will be testimony later on today that really goes into the economics of the bill, and I will let the economist share all of those details rather than trying to share them myself. But I think finally, as we talk about this legislation, which I do view to be an ever-evolving conversation, I want to sort of address the question of studies. I know that studies have been done in other states to look at not only how you would pay for this, which I think we have successfully laid out in the legislation and with the economist who will testify later, but also to really look at the transition. How do you move from a single payer, from our current system to a single payer system? And so I hope that with the committee, we can talk about what a study to figure that piece out might look like in real ways, not something that takes several years to complete and looks back and asks for us to gather more data, but something that looks at our current situation and talks about how can we really do this in a timely manner to make sure that Massachusetts is really providing accessible, affordable care to all of our residents. And with that, I am very happy to answer any questions the committee may have, and I look forward to a robust conversation with the committee chairs.